Hello everyone, once again with the cardiovascular system, and today we're going to talk about congenital heart diseases. Now, first of all, what is congenital heart diseases? They are abnormalities or deformities in the heart anatomy that evolve or forms during the heart formation in the first 8 weeks of pregnancy. Uh, the diseases themselves evolve right after birth or a little bit later. For the types, there are really many types for congenital heart diseases, and that range from really fatal ones to normal ones, and ones they're not really only congenital heart diseases, but can happen due to other factors such as the aortic valve stenosis, which we'll talk about. So first, first we'll talk about the atrial septum defect and ventricular septum defect. If we're going to simplify this, we're going to say that it is merely a hole in the wall. So we got, as we said in the anatomy videos, that there is ventricular septum and atrial septum that separates the right ventricle from the left ventricle and the right atrium from the left atrium. In this type of disease, there is a hole. This hole is not really known why it evolved. However, it is there, and it forms a pathway that shouldn't be there in the first place between the chamber. Its effect is that it mixes up the deoxygenated blood with the oxygenated blood and vice versa. What can this happen? What can this cause? Actually, more effort done by the heart to deliver oxygenated blood to the body tissues, and more effort done by the lung to have just oxygenated and deoxygenated blood going to it and coming back as again oxygenated and deoxygenated blood. The symptoms that can diagnose such a thing can be merely heart murmur and high breathing rate if the opening is large, if the defect or the opening is large, because we're going to see now that there are two types. Either the opening is small, and in this case it may just heal on its own and closes, or it may be there, however its effect won't be really devastating or won't cause high effort on the heart and lung part. However, if the opening was large, there it can be healed through an open heart surgery, in which one of three scenarios can happen. Either the cardiologist take a patch from the pericardium and closes the opening, as we can see in the picture over here, or insert a device through thoracic catheterization that closes this opening, or merely by sewing the lower and upper part of the opening with each others to close the opening and return the heart to normal. The second congenital heart disease that we may have are aortic valve stenosis and pulmonary valve stenosis. Valve stenosis in general is a case in which valves are thickened and immobilized, usually due to accumulation of calcium, and in this case we can call it calcific, either calcific aortic stenosis or calcific pulmonary stenosis, or merely due to wear and tear of the valves due to aging, because due to aging we'll have a decreased collagen and so on, and decrease in elasticity of the valve. So we have what is known as valve stenosis. For the pulmonary valve stenosis, we got two subtypes. It is the subvalvular pulmonary stenosis and supravalvular pulmonary stenosis. This is not actually the problem in these cases is not in the valve itself. However, in the canal before or after the valve, it is a little bit tight. As you can see here, the problem with the stenotic valve is that it doesn't really closes well, neither opens well. So for the causes, if it's congenital heart disease, it would be due to defects in the formation in the first 8 weeks, as we said earlier, or the valve itself is just have, instead of being a tricuspid valve with 3 leaflets, it has just 2. Or a high LDL or low density lipoprotein cholesterol in the blood, which causes deposition on the valve, therefore leading to stenosis. As you said, decreased collagen due to age. Rheumatic fever can cause such defect, and carcinoid syndrome. As for the effects for pulmonary or aortic valve stenosis, first of all, in case of the aorta, the obstruction of blood flow would decrease the oxygenated blood flow to the body organs, as well as enforce more pressure, or we can say more effort on the heart muscle, which in turn can lead to weakening and stiffening of the heart muscle. The pulmonary as well can cause such a thing, and the pulmonary valve stenosis, and also can cause what is known as right ventricular hypertrophy, in which the right ventricle muscles start to thicken really too much to be able to push the blood to the small opening of the valve. Now this disease had really high mortality rates, giving up to 25% in the first year of the evolving of such case, to 50% in the second year. However, this is for the aortic valve stenosis, and as we mentioned earlier, it is not only a congenital heart disease, but sometimes it is due to aging or other factors. Now, for the symptoms, in case of being congenital, it would be failure to gain weight, poor feeding, serious breathing problems due to having more effort on the lung part, as well as the low volume of oxygenated blood reaching the tissues, therefore forming some form of hypoxia. Also from the symptoms, the cardiovascular can hear a heart murmur, a click, or just an abnormal sound from heard only from the cystoscope. Change in the quality of the pulse in the neck, chest pain due to the hypertrophy, which we stated over here, that may happen in either the right ventricle or the left ventricle. Quick fatigue, fainting due to the loss of oxygenated blood, swelling in the feet and ankles, and so on in case of pulmonary valve stenosis. Now for the solutions, we got some famous solutions, some easy ones and some hard ones. First, we will have the valvectomy. It is a surgical removal of the scar tissues that prevents the valve itself from opening, because this one of the defects is that the valve can have extra tissues that cause the leaflets to be fused together. So in valvectomy surgery, these tissues are removed. Now we have the other one, valvectomy. In this case, the valve itself is removed, and it is placed with an outflow patch to improve the blood flow. We have valve replacement. Yes, the valve itself is removed. However, it is replaced with another valve from another human. And finally, we have balloon dilation or balloon valvoplasty. It is an insertion of of a balloon through catheterization on the tip of the catheter that the cardiologist inflate and deflates. And finally, balloon dilation or balloon valvoplasty, in which the cardiologist would insert a catheterization with a balloon on its tip, and this balloon would enter into the valve, and it would be inflated and deflated several times until the valve opens and the stenosis just go. Now for the third congenital heart disease would be the coarctation of the aorta. Coarctation of the aorta. It is merely tightness in the aorta, and it is considered a left side heart disease. The causes of such case is improper development of the aorta, valve abnormalities on the left side of the heart, such as mitral or arterial valve stenosis, can cause such case. Contraction in the ductal muscle in the aorta would evolve in the COA, and it happens actually along with the closure of the ductus arteriosus. Now for the effects, due to having a tightening in the aorta, the level of oxygenated blood reaching the body won't be really enough. However, if we concentrated, we'll find out that usually the tightening is after the arch of the aorta. So the upper vessels, the vessels that enrich the upper part of the body are okay. However, they are not really that much okay. However, I mean in the level of oxygenated blood reaching the tissues, it is good and pretty much enough. However, for the lower part, it is there is low amount of oxygen. Due to this, we can have cramps in the legs and abdomen due to the low level of oxygen. And for the upper part of the body, due to the high pressure that is happening in the vessels, we can have headaches. We can have left ventricle hypertrophy, in which the left ventricle enlarges to be able to pump much more blood to sustain the lower part of the body tissues with the oxygenated blood. We have, due to the high pressure in the upper part valves or arteries, the arteries or the vessels themselves may become weakened and would in turn be vulnerable to bleeding, and the whole body would be vulnerable to strokes. As for the kidneys, since they're part of the lower part of the body and they have a decreased input of oxygen, they will in turn have a decreased urine output and increase in blood pressure, as we know that the kidney have help in homeostasis for the body. So when the flow of blood to the kidney decrease, it would release some hormones and chemicals that would increase the blood pressure. So the symptoms for such a disease would be heavy or rapid breathing, pale skin, sweating, low pulse in the femoral or leg pulses because we have low blood input in these parts, and in turn a high pulse or high blood pressure in general in the upper part. We can have nose bleeding and a heart murmur as well. For the solutions, it is mainly a surgery. However, the surgery can have many outcomes. They may cut off the tightened part and soothe the rest of the aorta, or they may open it, and in the place of the opening, they would place a patch. The tightened part can also be cut off and a patch is sewn instead, or a bypass can be made for the blood to just skip the tightened area of the aorta. Now, for another congenital heart disease would be the patent ductus arteriosus. Now, for the fourth congenital heart disease, we have the patent ductus arteriosus. It can be simplified down and just remembered as an unclosed hole that allows the blood to drain from the aorta to the pulmonary arteries. Normally, this is a condition found in the fetus heart. However, it shall closes during the first 72 hours of life. In some cases, this doesn't actually close, and it is caused by the absence of normal constriction of the elastic tissues in the walls of the blood vessels, basically the aorta. Um, and it has such effects as excess blood flow to the lungs, as it is not just the blood pumped from the right ventricle that enters the lung, however, also that drained from the aorta. This would cause hard work from the heart side due to the drained blood reaching the body, as well as a hard work on the lung side due to the excess blood coming into it. The symptoms we would have, as usual, a heart murmur. We will have faster and harder breathing than the normal, trouble in feeding and growing rates for the children, and may cause permanent damage to the lung vessels, the pulmonary arteries. Now, for the solutions, there are some medications that can be taken or just a surgery. And in this surgery, the opening can be just tied off, or by inserting a device such as that inserted in case of the the atrium septum defect and the ventricular septal defect. Now, for the fifth case, we will have dextro or levo transposition of the great arteries. Now, these are two cases. However, the fatal one would be the dextro, because it is actually an abnormality in the placement of the aorta. What actually happens is, instead of having the aorta normally placed to take the oxygenated blood from the left ventricle, it is placed in the right ventricle, so it takes deoxygenated blood instead and starts transferring it to the whole body. As for the levo case, what we have is just a change in the placement of the pulmonary artery. Instead of being just behind the aorta on one side, it is in front of it, and we have morphological changes in the left and right ventricles. As for the causes, it is merely developmental defects, and what happens is that the blood flow is really stuck into one of two cycles, either body-heart body, in case of the aorta, because as we can see here, just the deoxygenated blood gets into the right part of the heart and then is pumped back to the body, so it doesn't go through the lung. And on the other side, we have the oxygenated blood going just from the lung to the heart and back to the lung again. So these are the two cycles that happens between the heart and the lungs in such a disease. That's why it is fatal. The symptoms, the most known one is cyanosis for the babies, and it is known as a bluish color in the toes and fingertips, mouth, and forehead. It is usually because these are just the outermost tips of the body. which have low oxygen intake. They have, of course, a problem. Sorry, problems in breathing, poor feeding, weak pulse, and a pounding heart. As for the solutions, now for the solutions, first a temporary leakage that allow oxygenated blood to be mixed with the deoxygenated blood would be done to help deliver some oxygen to the body tissues until a surgery is made to have an intraatrial baffle. What happens during this surgery is that the superior and inferior vena cava pathway would change from depositioning the blood in the right atrium to positioning it in the left atrium to go to the left ventricle, and then the left ventricle would pump the blood instead of the to aorta. It would pump it to the pulmonary arteries, and then the pulmonary veins would position the blood to the right atrium, to the right ventricle, and the right ventricle would pump it to the aorta and in turn to the rest of the body. Now for the fourth, for the sixth actually and final disease today, it is the tetralogy of Fallot. It is a convergence of 3 to 4 defects. We have usually a ventricle septal defect. We have pulmonary valve stenosis. We have right ventricle hypertrophy. We have super and subvalvular stenosis, or tightening of the pulmonary artery, and we have an overriding aorta, or a detransposition of the aorta. For the causes and the symptoms and the effects, it is just merely the same as a combination of all those syndromes that we have discussed earlier. And for the solution, it is a surgery for a number of corrections known as intracardiac repair. In this repair, first the doctor would use a patch uh, to repair the ventricular septal defect, and would repair the pulmonary stenosis, usually using the balloon dilation method, and widen the pulmonary artery, and if there is stenosis, subvalvular stenosis. That's it for today, and here are the references, and hope you enjoyed and hope you enjoyed this video.